Well, turning now to this, today is World NTM Day. It's a day focused on raising awareness about a little-known lung disease that experts say is often mistaken for asthma, COPD, or even chronic bronchitis. Non-tuberculous mycobacteria, or NTM, lung disease can take months or even years to diagnose, leaving many patients searching for answers. Joining us now to explain the symptoms of this disease and who's most at risk and why early awareness matters here is Amy Lightman. She's president of NTM Info and Research. Amy, we thank you for joining us this morning. Really important to have this conversation, especially for people that haven't heard of this. So let's start with this. What is NTM lung disease and how is this different from tuberculosis?
So NTMs differ from tuberculosis in that TB is considered contagious. It's considered communicable. NTMs are not. They're environmental pathogens. They're in soil and water. We're all surrounded by them. Most of us go about our daily lives and aren't affected. But if you have an underlying lung condition that makes you more vulnerable, if you have an immune condition that makes you more vulnerable, you could end up with an infection in your lungs or in some cases in other parts of your body like skin or soft tissue.
So let's kind of compare and contrast here, because a lot of times this disease is either not recognized or it's mistaken for something else. I know you mentioned a lot of people who are vulnerable are susceptible to this. Is that why it's usually under-recognized or maybe mistaken for something else?
Yeah, that is a big part of the reason. The symptoms are the same. A lot of them are the same as other diseases. Until recently, it was considered fairly rare. They didn't think it affected that many people. But, more recent studies have shown that it affects more people than previously thought. And that incidence is rising every day and every year in the United States. It's rising 8% a year. And part of that has to do with more awareness, and part of that has to do with the fact that we have an aging population. And as we age, our immune systems age.
So those people who may be at greater risk, and you talked about those vulnerabilities, right? So I know COPD is certainly one of them, some other underlying health, lung conditions, I should say. Can you list kind of the top ones that could really put people at risk if they have those conditions? They're at more of a risk for having this.
Sure. So one of the top ones is something called bronchiectasis, and that's kind of a scarring in the lungs that leaves the airways of the lungs sort of permanently dilated and less able to sort of do the job of clearing the mucus from the airways. That's an important one because there are a lot of things that can cause bronchiectasis. There are genetic conditions like cystic fibrosis that cause it. Prior pneumonias can cause bronchiectasis in certain areas of the lungs where you had the infection. There are just hundreds of ways that you could think of. There are, environmental insults. Sometimes if you had an exposure to an environmental toxin that, something like asbestos that would cause, an insult or an injury to the lung might also cause that as well. We've seen it, with patients who've had lung cancer previously. They might have also some bronchiectasis, and that also leaves them more vulnerable. So that's the top one. But like you said, COPD is also another one. And people with underlying immune conditions that have weakened immune systems, that's another big one as well.
You mentioned, the COPD, of course, lung cancer. You tend to think of those and you think of like a chronic, persistent cough. You think of shortness of breath and those sorts of symptoms. Anything else people should watch out for to possibly identify NTM lung disease? Yeah,
so it's the fatigue, cough, and shortness of breath. And also, if you're having sort of a low-grade fever that's persisting, if you're losing weight. And another big one is if you're having 2 or more respiratory infections every year. If they keep coming back, those infections, you need to start asking why that is. You need to ask your doctor, can we take a closer look and identify what's causing these infections so we can treat it with the appropriate medications? Because in that case, if it is NTM, you don't want to just throw, a 2-week antibiotic course at it. You want to make sure you get the proper course of treatment, which is multiple antibiotics.
I think for patients and for communities, it can be, a little bit challenging to figure out what to even ask if you're having these symptoms, if you think that it's something that could be concerning. How do you advise for people to just be informed about what to ask a medical professional to make sure they're asking the right questions, telling them the right information to possibly identify a disease like this?
So we actually have a lot of information on our website, and if you go to worldntmday.org, everything is linked from there, including questions to ask your doctor. But I think, like I said before, the first question to ask your doctor is, why does this keep happening, or why am I not getting better? what are other tests that can be done. It's two simple tests, really. It's a CT scan, and then it's also, a test of the sputum in your lungs to see what grows from it, what's growing in your lungs. So it's not really complicated to diagnose. It's just that the doctors have to order the correct tests.
Absolutely. And in addition to finding out more information, what else can people do to participate in this day?
So we have a lot of information online. We have social media posts that people can share to help inform others. So I encourage people to go to worldntmday.org to get those social media posts, share more about it. Go to ntminfo.org to learn more about this disease. And if you or someone you know has these symptoms that you're recognizing, talk to them about NTM and have them talk to their doctor about getting a diagnostic workup for it.
Awesome. A great conversation to have any day, but especially here on World NTM Day. Amy, thank you so much for joining us this morning.
Thank you.